Hi, everyone. Welcome to RightSleep Sleep Chats. This is a series of short videos featuring RightSleep creator Dr. Stasha Gominak answering some of our frequently asked questions, as well as others you may not have thought of to ask. We'll tackle one question at a time to help you improve your sleep and ultimately improve your health. We've been asked a lot of questions that start with, will RightSleep help with blank? And then they include a condition that they have. So we're doing a series of sleep chats that addresses those questions. Stasha, what does sleep have to do with arthritis?
Hi, my name is Stasha Gominak. I'm a retired neurologist and now I'm a sleep coach. And Heather and I are doing a series of short videos to address separate issues. We just did a video about sleep and rheumatoid arthritis, but I wanted to do a separate video about sleep and what is generally called osteoarthritis, which is not completely different from rheumatoid arthritis. There are some features that distinguish it, but I want to point out that arthritis of any kind in any joint in the body, including the jaw joint or neck joints or hand joints or hip joints or knee joints, are all about lack of appropriate repair of those joints during sleep. How do I know that? Because there are 90-year-old people walking around who have no joint pain and have normal joints. Now, do you hear very much about them? No, you don't. They don't go to the doctor. They don't get their hip joints replaced because there's nothing wrong with them. And they have good mobility and no pain. What that means is our bodies are designed to be able to regenerate every single piece of every joint that we have and make it last for 90 years. That's a pretty phenomenal idea. But in actual fact, I want to give you a picture of what's supposed to happen every night. And I'm going to use the hip joint, and I want you to picture a ball and socket joint. So there's a ball, here's a socket, and be able to move around with the amount of movement that the hip joint has. You have this nice shiny surface that has a lubricating fluid inside. So both the socket and the ball have a very smooth surface with lubricant. And every single night as we sleep, if we get appropriately paralyzed and if our repair processes are working normally, the pitted, cracked surface of that ball joint and the socket is stripped off by a set of little workers, kind of like stripping off the asphalt on the road outside your house. And then a new, shining, perfect articular cartilage is laid down again by another set of workers, just like laying the new asphalt. So if you have not hurt yourself, there are not processes that bring in white blood cells that cause chemical changes, etc. Those inflammatory changes only happen if you've injured yourself, and they stop happening as soon as you're completely repaired. So our normal state is to be able to repair every joint in our body every night. The joints that we have injured probably take a little bit more time to repair normally. So you've already experienced, if you hurt something, that it may take 2 or 3 days or longer than that to bring it all the way back to normal. And you may have also noticed that people say things like, I have a bad knee. And that refers to a severe injury in the past that starts to show up with pain again in circumstances of either overuse or bad sleep. And the hard part is not having normal sleep is so common nowadays that we don't realize that what's really happening is my bad knee that used to just take longer periods of appropriate repair at night is now not getting any nights of appropriate repair. And then it becomes a real problem. And what the doctors have to offer you is knee replacement. But if you fix your sleep, you improve your paralysis and sleep by using the RightSleep program, and you lessen the amount of inflammation in the body, you can actually repair your own joints.
That is amazing. You reminded me of a 92-year-old neighbor that I had who came over and helped me cut down a tree and then haul it all away. No joint pain. So, all right. Well, thank you, Stasha, and thank you everyone for joining us. Please subscribe to the channel, then like and share our videos. You can find more information as well as the Right Sleep program at drgominak.com. Remember, we see our doctors once a year because we heal our bodies every night. Until the next sleep chat, sleep well. Bye-bye.